Distinguished HWG delegates, ladies and gentlemen, good morning. I'm very pleased to get together with you today in the beautiful city of Cebu. This is the third SOM meeting and the second HWG meeting for the year 2015. First, let me warmly welcome all of you, especially those who travel from afar. Since we are more than halfway through the APEC agenda for this year, so it is high time for us to hold the second HWG meeting to look back and to review what we have achieved so far and to look into what we can achieve in the remaining time of this year and beyond. First, we look at the agenda. I believe you have in front of you on the table a draft agenda. We will have 13 agenda items for the meeting. It's a two-day meeting. For today, we have 7 agenda items. Those items include review of HWG calendar events of the year 2015, review the 2015 HWG work plan, update the terms of reference of HWG, and also the HWG strategic plan. Also, we will discuss the HWG 2015 deliverables. And also we will introduce the new HWG concept notes for the session 1, 2016, and the new self-funded projects. And also we will give you an update on the APEC management. There will be 6 agenda items for tomorrow, including the selection of the HWG chair for the years 2016 to 2017. And we will discuss the ranking of results of the new concept notes. And also we will discuss the paragraphs to be submitted by HWG for consideration by SOM in the Leaders' Declaration and Joint Statement of Ministerial Meeting. And we will hold a joint session with other APEC fora and other international health bodies, updates and discuss and approve the self-funded HWG projects. And we will listen to Peru to give us a briefing on their plan for next year's HWG meetings. Those are the agenda items we have on the table, and we have circulated before the meeting. I will seek your comments and suggestions. Is there any objections to the arrangements of the agenda? I see none. The agenda is approved. So now I would like to invite Dr. Kenneth Hatingengo, the Under Secretary of Health of the Philippines, to deliver a welcome remark. Dr. King.
Thank you very much, Chairman. This is a welcome remark, and I'm representing the Department of Health Secretary, Janet Loreto Garin, in welcoming all of you here. Honorable ministers, distinguished guests, ladies and gentlemen, a pleasant good morning to everyone. It is my honor and privilege to address the Health Working Group meeting for the second time. I remember in SOM 1 in Clark, Pampanga, I reiterated the need to fully support the priorities identified in the Healthy Asia Pacific 2020. Now more than ever, we have recognized the need for everyone to build on the gains from all our initiatives. The APEC roadmap that we have developed and will be implementing should be dynamic enough in content as to be inclusive of the updated technology and responsive to the emerging needs, and is building on the progressive gains from multi-sectoral participation. Now, as we have recognized the gaps in our pursuit in achieving the Millennium Development Goals and its special challenges, this roadmap should be maintained and, as necessary, expanded to include the process of charting the future of global health. We congratulate our colleagues from China for pushing for the approval of Healthy Asia Pacific 2020 document last year at the in the fourth APEC high-level meeting on health and economy. This document gave emphasis on the critical need to ensure that sustainable and high-performing health systems will be developed and will be taking on the health in all policy and the whole of government and society approach. The global community has long recognized that the contribution of improved health in ensuring the progress across the three pillars of economic growth, social equity, and environmental protection. That is why we reiterate our full support for the priorities highlighted in Healthy Asia Pacific 2020 initiative. Note worth mentioning is the prevention and control of non-communicable diseases. The WHO estimate the cost of reducing global NCD burden is pegged around US $11.2 billion a year. This figure is very alarming. We need to address this and its continued national, regional, and international support, particularly for the conduct of further researches to develop and introduce innovations and interventions like vaccines and point-of-care diagnostic tests. There has also been an increased global focus on emerging infectious diseases like MERS-CoV, Ebola virus diseases. 2014 taught the global community 4 lessons that should shape future actions when it comes to emerging infectious diseases. First, is the lesson that strong health systems in the presence of basic health infrastructure are keys to withstanding sudden shakedown of the health system. Second, there is no such thing as being over-prepared. We all know that countries with strong surveillance efforts were able to prevent the explosion of the disease and were eventually declared EID-free. Third, is a recognition that one intervention should always be complemented by other interventions. And lastly, presence of infrastructure, presence of health personnel should be accompanied by deep community engagement. Furthermore, antimicrobial resistance being a growing threat is underscored in Healthy Asia Pacific 2020 initiative. The inclusion of AMR highlights the need to ensure that we will not lose the benefits of antimicrobial usage. This issue is closely linked to the increasing healthcare associated infections being experienced in all the regions. On mental health, we agree that it deserves an important mention in both APEC Ministerial and APEC Leaders' Declaration this year. It should emphasize the importance of integrating efforts of public health with that of private sector in the identification of innovative and creative solutions to this growing burden. In this meeting, I understand it will discuss as well the updating of the APEC Health Working Group strategic plan. I hope that there will be a frank assessment of the current process of translating the APEC Trust. The updated strategic plan should be able to address the following concern: the true complementation of efforts of APEC with that of other bodies such as ASEAN and bodies within the UN system. Effective governance mechanism with member economies that can better support APEC. And lastly, regional action points that should prioritize and trigger a domino effect on other sectors. The Health Working Group has consciously initiated efforts to collaborate closely with other APEC fora and sub-fora for complementation of initiatives. If there is one message that should not be lost here, it is the message that we can no longer work independently from one another. We have to do more collaborative work with other stakeholders, with non-state actors. By now, we should be able to identify the strengths of government and of its partners, fully maximize the available resources such as private-public partnerships in health. The Integrated Sustainable Development Agenda requires an equally synergistic framework of means for its implementation, including financing, technology, and investments in sustainable development capacity. This was stated, in fact, in the synthesis report of the UN Secretary General on the post-2015 Sustainable Development Agenda. It simply means that cutting across all our efforts in APEC, we should emphasize inclusivity and accessibility for all to enable us to reach universal health care. This is an area that strengths of APEC should be fully able to contribute to. With a renewed interest in health, we hope that the collective efforts in APEC help put a strong foothold of health in economic and trade discussions, which are usually prioritized at APEC. At this point, let me thank our colleagues from China for a very efficient hosting in 2014 and chairing as well of the Health Working Group. We hope that the Philippines will be able to at least continue implementing the high standards set by the previous APEC meeting hosts. During the next few days, I'm certain that you will have the opportunity to explore this side of our country. Let me then give you a brief about the province of Cebu. The name Cebu comes from the old Cebuano word Cebu or Cebu, meaning trade, a shortened form of Sinibuyang Higpit, or the place for trading. It was originally applied to the harbors of the town of Sugbo, the ancient name of Cebu City. Cebu is popularly known in the country as the Queen of the South. It has a proximity to many islands within Visaya region. It has a very rich cultural heritage from our Spanish ancestors, the lovely beaches, the hotel, the resorts, diving locations, and heritage sites. And the high domestic and foreign tourist arrivals have fueled the tourism of this city. I hope everyone will not go home to their respective countries without exploring this magnificent island. With that, on behalf of the Philippine Department of Health and the host economy, we thank you for your participation in this meeting. Mabuhay. Thank you.
I thank the welcoming remarks made by Dr. Kenneth Hattingangel on behalf of the Secretary of Health of the Philippines. I would also like to thank the host, the Philippines, on behalf of the HWG for all the work they have done to make this meeting possible. As we all know that this year's APEC theme is inclusive building. Sorry. I think with all the joint efforts of all the member economies, we developed Asia Pacific 2020 initiative last year, and this year's theme is building inclusive economy. So based on the theme of this year and also the initiative we adopted last year, one of the priorities of this year is to chart a roadmap of the 2020 Health Asia Pacific roadmap. On the first meeting of HWG, we decided that the work will be carried out by the Philippines. And we have some preliminary discussions on this issue already on the first HWG meeting. And after that, HWG has carried out this work as planned. So at today's meeting, we will review the health deliverables for this year, including the roadmap of the 2020 Health Asia Pacific 2020. And these deliverables will be submitted to SCE for their approval and adoption. In addition, a very important announcement, as my term as chair of HWG will expire by the end of this year. So according to APAC rules and procedures, we will select the HWG chair for the years 2016 to 2017 at this meeting. By now, the Secretariat has received some nominations for the selection of the chair already. And also the window for nomination will remain open until the noon tomorrow. So any interested parties can still make your nominations by 12 o'clock tomorrow noon. So now we start our agenda for today. The first agenda is to review the important event of HWG in 2015. First, I would like to ask the chair's office to give us some update on the work we have done since the first HWG meeting.
Thank you, Mr. Chair. I would like to give some review of the first HWG meeting of this year. Next slide, yeah. In the first HWG meeting, we reviewed the health deliverables in 2015, including the related parts in the leaders' declaration as well as the joint statement of ministerial meeting. And we also reviewed the HWG progress, outputs, and the deliverables in 2014. Next. And we also discussed the theme for this year on that meeting. We introduced the theme and priorities of the whole APAC of this year, as we'll also discuss and adopted the theme for HWG of this year. We made discussion and adoption on the 2015 HWG work plan. We also made some preparation on the deliverables for 2015. We discussed the concept paper for the roadmap of working towards a healthy Asia Pacific 2020. We also reviewed the progress on 11 ongoing projects to identify potential deliverables for this year. For the management issue, we selected HWG Vice Chair for year 2015 to 2016. We also reviewed the progress of HWG Strategic Plan 2013 to 2015 and discussed the update of the strategic plan of 2016 to 2020. We welcome that the Australia and Vietnam offered their leading in the drafting of this strategic plan of 2016 to 2020 last month. We also discussed on the concept paper of development of guidelines for engagement between HWG and the private sectors, as well as discussed the update of HWG terms of reference and tasked China to lead the drafting. As a very important part, we discussed the new concept notes and prioritized all 7 new concept notes for Session 1, 2015. That was the first in-session prioritization of new concept notes for HWG after the adoption of the new guidelines of prioritization for new concept notes of HWG, which ensured the transparency of the prioritization process. We also listened to one introduction on the self-funded project. We had joint sessions with LISF, PPWE, SMEs, HRDWG, EPWG, and WHO to discuss some cross-cutting issues and share some progress. Thank you. That's a review for the first HWG meeting.
I thank the Chair's office for the review of the first HWG meeting and the work we have done since then. I think the introduction is helpful for us to understand the agenda setting for this meeting, and to ensure that we have a good connection between the two meetings. Next, I would like to invite our Vice Chair, Dr. Beltran, to give us some introduction on the health policy dialogue we just concluded yesterday. Dr. Beltran.
Thank you very much, Chair. And again, good morning, everyone. Let me share our report from yesterday's event. We conducted a health policy dialogue yesterday. And next, please. We've titled actually the health policy dialogue as Healthy Asia Pacific 2020 Amidst Disasters and Outbreaks, Lessons Learned and Promising Practices. So we set out 3 objectives: discuss the economy's experience of its health system's ability to respond to health-related security and humanitarian emergencies. The second objective was to identify potential areas. Go back, please. Potential areas where, identify potential areas where economies can integrate lessons learned in other contexts to improve preparedness capabilities and increase the resilience of the healthcare system. And then the third objective was to